think the real reason that the Red Flag project has worked at the West Suffolk is that all of the team are on board. Everybody in the multi-professional team work together, and that links in nicely. We don't have one person starts and one person's finished. Everybody works as a team, and everyone owns this project and believes in it and knows that it improves the patient's safety and the care that the patient receives. This project could work anywhere. It's especially tailor-made for the treatment of patients with a fractured neck or femur, but with a little bit of moderation it could be used for any vulnerable group of patients.
The Red Flag project has brought the whole team together. It provides a rounding experience for the patient. We visit the patient regularly, and we've actually been able to demonstrate a really good quality of care, reducing pressure ulcers and falls, improving nutrition to our patients.
The Red Flag has helped us to actually go around every 2 hours, make sure that people have got drinks in front of them, are turned or standing up, have been offered a snack, have been toileted, just everything really to prevent pressure sores and prevent falls. We've used a lot more resources in that we use a lot more air mattresses, the heel protectors, the cushions for the chairs. People are identified as well when they come in for enriched diets, nutrition assessments and things like that. It's definitely improved patient safety. If you look at all the data that we've collected since we started in May 2009, we've actually reduced our falls and pressure sores. And last month we actually had no pressure sores and no falls.
One of the key messages I'd want to get to colleagues in other hospitals is that if members of your ward teams come to you with a good idea, you should embrace that. They know what's best, they know the good quality nursing care, and one of the key things that we've got to do in the health service is going through difficult times, but actually we must concentrate upon patient safety and patient care, customer care, and it's the staff on the ground that can really make the big difference, and taking the leadership from those local staff to implement good ideas, and if it works, to monitor it, to audit it, to get the results, and then disseminate it both within your own organisation and beyond. That makes a huge difference, and together we can all make an impact upon patient safety and the quality of care.
My name's Andrew Collett. I'm a volunteer on F3 at West Suffolk Hospital, and I've been assigned to this ward for the last 18 months. What happens is, as soon as the bell rings, I put on this apron, and I'm giving help with the lunches. I take them to the patients, having to move probably jugs of water, sweets, biscuits and things to clear it so they can actually have their lunch. Tell them that it's a first-class service, it's a 5-star hotel. Cut their food up if they've had an operation on their wrists or something like that, and make sure and butter their bread and make sure that they can actually eat their meal and reach it without it being too far away from them in the bed or the chair, wherever they are. I think personally it's very important because I enjoy meeting people. I was in retail for many years and I missed that, and now I'm back here working with the patients. They can't get away from me. So anyway, we have a lovely little chat, and I run and get them water or pass things to them, go and get batteries for deaf aids, go and buy their newspapers for them, providing they pay me, but sometimes they don't, but that's part of the service, and make them feel very happy and contented.
Since the Red Flag project was introduced, we've seen a reduction in falls in patients and pressure ulcers, and we've also seen staff empowerment. Staff feel happier, they feel more comfortable and looking after the patient group. We didn't need any more resources. It was just about really putting in an effective, reliable system of care, and the critical kind of success factors for that was around the reliable system that everybody knows what they're doing, everybody's on board for, the clinical leadership is really important, and that staff engagement.
If I was to make one recommendation to any nurse wanting to work within the NHS, that would be to make sure you smile, you're friendly, and you talk to all your patients. Smiling goes a long way with elderly patients.
I fell over in my front garden and I had to have an ambulance, and they rushed me here, and they were absolutely brilliant on the Sunday. They couldn't do the operation because I'd had tea and everything to drink. When I got here, everything was brilliant, and they brought me up to F3, and everybody looked after me as if I was the Queen of England, really. And then on the Monday, they operated on it, and When I came round, everybody was sorting out and looking after me. And then...
Did you feel safe?
Yeah, I felt so safe. There was no need not to feel safe.
No.
Because there was somebody there all the time.
Okay.
And then on Tuesday, I got up, walked around, and then...
Did the physios help you walking?
Yes, the physiotherapists, cool, they make you work. They do make you work hard, which is good for your own benefit. And then I went to, on the Wednesday, I kept saying, I want to go home, I want to go home. And on Wednesday evening, they rushed around. They really did rush, even down at an X-ray, done my X-rays for me so that I could get home. There's always somebody there to help you.
That's good.
Always. No complaints whatsoever.